One of the issues that we have heard both globally and here within Canada is of the drastic need, the dramatic need for ventilators, for masks, for PPE, personal protective equipment. And we're going to tell you the story next of a Toronto hospital that is actually soliciting donations because of the need to boost that number and that stockpile of protective gear. I want to introduce to you Dr. Michael Warner, who's the Medical Director of Critical Care at the Michael Garron Hospital in East York, and also the Chair of the Critical Care Section of the Ontario Medical Association. So he gives us the provincial overview as well. Dr. Warner, it's a pleasure to speak to you this morning. Thank you for giving us time today.
Good morning, Heather. How are you?
I am very well, and I'm very interested in what your hospital is doing. This gets underway in just about 5 minutes' time. What is the infection control team and some other teams at the hospital? What are they launching this morning, Dr. Warner?
So, the genesis of this idea was actually one of my good friends and I. There are lots of members of the community who want to contribute to the effort to fight coronavirus. And the government has made really important announcements about ramping up production, but there's going to be a time lag between now and when that supply comes online. We know there's lots of personal protective equipment in the community, dentists, veterinarians, nail salons, construction sites, pest control, etc. And we know the community wants to help. I received many emails before creating this website about people asking how they could help. So we built a site and we got endorsement from our hospital to receive donations, to process them, to make sure that they're cleaned, and then distributed to wherever they're needed. So that drive, and it's theppedrive.com, starts this morning at 7:30 at Michael Garron Hospital, and we hope it's replicated at other hospitals. And the website was built such that other hospitals who want to join this effort can simply add on to our website and put their own map and community information up there.
And we're looking at it as we speak, as a matter of fact. So you said you're encouraged by what the province is doing, but still concerned that there won't be enough. I mean, what is the worst case scenario? How soon could you run out?
So I just want to impress upon you and your viewers that there's no bigger issue in Canada right now than the manufacturing distribution of personal protective equipment. It's our first line of defense. Without personal protective equipment, we will not be able to assess or treat patients who have coronavirus or for whom we're suspicious they have coronavirus. This is the first link in the chain. There's nothing more important, and we need all pieces of personal protective equipment. If I don't have gloves, but I have a mask and a gown and a face shield, I still can't go in the room, so we need everything. Each hospital will have its own inventory of personal protective equipment and a burn rate, how quickly they're going through it now, and perhaps a projected burn rate. And we need to know how much each hospital has. There needs to be coordination across jurisdictions to make sure this supply can move. We need all community PPE, and we need the government to ramp up production. But there are some hospitals, including my own, that have a foreseeable lack of this PPE within weeks.
So what would your burn rate be? That's a phrase I haven't heard, the burn rate. I mean, when could you, what are you talking, days? Are you talking weeks before you might run out of your supply?
A few weeks and as I mentioned, Heather, if I run out of just one element of that PPE, it's like a puzzle. If you don't have all the pieces, the picture doesn't look good. So we need to have adequate supplies of everything. And the situation, colloquially, is actually more dire at other hospitals. And if we get a deluge of patients tomorrow with COVID-19, our burn rate could increase by an order of magnitude. So this is why this is critically important.
And why you're having this drive every day, all this week. I guess it's just a bit stunning to listen to you say you're soliciting donations from people like vets and from construction sites and contractors. Why do they have the protective equipment that our healthcare professionals, our ICUs, our critical care units don't?
So I think all those industry people and other professionals have them for good reason, because they need them to protect themselves. But we need to scale down construction, perhaps cancel all non-essential construction. And this is not the time to be drywalling or woodworking or working in pest control. This is the time to gather all that PPE and give it to us in the hospital. There will still be emergency veterinary procedures and dental procedures, so we need to save a supply for emergent procedures for other people so they can protect themselves. So it's not a problem that they have it. It's actually great that they do. We just need to get it in a coordinated way.
get it to the people who really need it so critically at this particular time. I'm wondering generally, Dr. Warner, before I let you go, because you have to go in and do your very important work at your hospital, you've been very outspoken in past interviews with CBC News about the fact that we are not, as a country, as a people, taking coronavirus seriously enough. What are you still waiting to hear from government? What are you still waiting to see delivered? And I'm wondering what you'd still like to say to Canadians.
So the most important message, social distancing or physical distancing, whatever we're calling it, should be mandatory. It should not be optional. The guidelines should not be guidelines, that there should be mandated instructions to Canadians across all jurisdictions, not just suggestions. With coronavirus, we've been playing defense the whole time. It's time to play offense. Incrementalism will be the fast track to collapse of the healthcare system. We need to be strong. We need to be bold. People need to take this seriously, but the government needs to give people clear instructions, not just suggestions. If we're going to threaten to use certain acts, I think we should institute the most aggressive measures today, because if we don't, we will eventually get there. But by then, the impact of those measures will be far less.
So consistent messaging, overreaction rather than underreaction. I mean, you have warned that the whole system could face total collapse if we don't get ahead of this. Are you still thinking in those dire frames?
Well, I really hope I'm overreacting. I hope that people look at these clips a year from now and say, Dr. Warner didn't know what he was talking about. That's what I hope. But when I speak to my colleagues in Italy, I don't think we can hope. I think we do need to overreact, because if we look anything like Italy or what the United States could look like, I don't even want to imagine that. So let's overreact. Let's do this together as a community. I understand there are social and economic implications, but those have to be secondary right now. While the community supports those people who are going to be hurt the most, we have to work together to protect all of us. I'll be unrelenting in this message, because we need to get it. We need to get it now. This is very serious. We're planning for what we do when we run out of doctors and ventilators in the ICU. That's our state of mind. So we need the government and people to step up and be consistent, be bold, be proactive.
If you will be unrelenting in that message, we'll be back to hear from you and what you see happening and changing and hopefully improving. But Dr. Warner, I appreciate our conversation this morning as you get set to invite the public to help you replenish your stores of key protective equipment for the doctors there at your hospital. Dr. Michael Warner, Medical Director of Critical Care at Michael Garron Hospital in East York.